Why treating regularly with a primary care provider can help keep you alive. Having a family practitioner, keeping tabs, keeps you right where you need to be. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical Clinic right here in Amarillo, Texas, and I want to talk to you about something I've always felt very strongly about. I've always believed in an integrated team of healthcare providers and that is the most effective way to approach healthcare conditions, certainly orthopedic or neuromusculoskeletal issues. In recent years, high-level research has supported my position on this. One of the most important pieces to the integrated team is the primary care provider, also known as a PCP. Now, before we get too deep into this, I want to remind you that you have friends and family that aren't taking good care of themselves, and they would benefit from you sharing this information with them. Many just don't understand why they need to stay on top of things. So help them understand and share this with them. They would appreciate it eventually, I promise. Now, you would not believe how often my patients either do not have a family primary practitioner, or if they have gone for medical care at all, it's just been kind of scattered or sporadically to an urgent care type facility or something like that. There are several reasons why this just isn't an ideal way to handle your health care, folks. Let's discuss it a little more in depth here. First, I want to cover what a primary care provider actually is. Now, we're going to refer to that as a PCP from here on out, okay? So a PCP is basically a healthcare provider, but can also act as a hub or a navigator. So let me explain that. PCPs are often your very first contact in the healthcare system for an issue or health-related complaint that you may be experiencing. They are best known for their ability to treat common illnesses and helping you prevent any issues that may be on the horizon. Research is very clear here. Having access to a PCP directly and very favorably impacts your health and your ongoing well-being, and your relationship with your PC can be a long-lasting lifetime relationship, as it should be. Now, this is in contrast to treating with an urgent care or similar type of facility when you get sick. The difference is, it doesn't mean that they are not helpful. Of course they are. They're saving lives out there. But the difference is that you have one provider that you have a professional relationship with that knows you, knows your condition, has tracked your health, and can make sure you're on track to not miss any of your mile markers. And I'll explain mile markers here momentarily. So the reasons for having a primary care provider, okay? It is incredibly important to establish your medical home. And what that means is that you have someone that you can turn to when you're faced with a scary illness, and you have someone who has the answers or knows the people that will have the answers. That can help you navigate the waters. It means there's a consistency to your care, a consistency that you do not get by going to various urgent care type clinics for care. And what I mean is for care that could and should be handled by a PCP. Urgent cares, I don't mean to speak poorly of. Urgent cares absolutely have their place in the healthcare system for acute illnesses and conditions like that. But should not be used, in my opinion, as a replacement for a primary care physician or practitioner. Now, PCPs provide access to specialists. Many times, in order to obtain higher level care, a referral from a PCP is necessary. PCPs work with specialists and experts like neurologists or oncologists and orthopedists to ensure that they have all of the information about you they need so that they can do the best job for you. PCPs make sure you don't miss your mile markers, as I mentioned. And what I mean by that is that, for example, females should have a mammogram at a certain age. Males should have their prostate checked at a certain age. Females should have a bone density scan at a certain point in their lives, and everyone should get a colonoscopy within a certain age range. So mile markers should not be missed, and doing so significantly puts people's lives at risk. Just doing some simple lab work once a year has the potential to uncover future issues that may be lurking under the surface that can be addressed early and effectively if they're caught in time. Now, those that keep their regular PCP appointments yearly are actually much healthier, according to research, because they're doing the right things right on time. Did you know that having an established PCP also means fewer hospital and fewer ER visits? That's right. Studies show us that those that visit their PCP regularly have fewer visits to the ER than those not having a PCP. Most likely because those not having a PCP wait way too long before seeking care, and delays can become very serious when it comes to one's health. So it's common for patients to see their PCP for things like illness care. And through illness care, that's what we mean is an earache, a bad cough, sinuses, a cold, or something like that. That's illness care. They also go to a PCP for preventative care, and this is when a patient is trying to stop illness before it comes about, which is way more cost effective to catch it before it happens rather than after it happens. Then it's a lot more expensive to treat. Another reason to visit is early alarm bells. Right? You might see your PCP when you're making sure there are no early alarm bells or harbingers of bad and more sinister illnesses that may be lurking under the surface. Things like cancer that might be in progress, or diabetes. And when it comes to conditions like these, you absolutely would rather know before than after the fact. And when you find out after the fact, treating it successfully, then it becomes much more of a challenge. Now, another reason to go to your PCP is chronic condition management. PCPs are excellent at helping patients control long-lasting conditions like diabetes, high blood pressure, arthritis, heart disease, and COPD, to name a few. With the help of a PCP, you can typically keep these issues under control. Without the help of a PCP, many spiral too far out of control to get back on track. Now, many people will visit their PCP because they are a hub or a navigator in the healthcare field. So PCPs are very good at recognizing the need to refer a patient out to a specialist, and they're able to get their patients there for more specialized advanced care for their condition. So there are lots of very good and very reasonable reasons to find a reputable PCP to establish your care with. One word of caution: don't go to the proverbial pill pusher, okay? If you go to a PCP that just seems to have a pill for everything on earth, well, that's not a positive sign in my opinion. It's lazy medicine and is not of particularly high value. For example, I once fired my PCP after several attempts on his part to put me on drugs that I just did not need. On one visit in particular, I had a rough morning and my blood pressure was high, probably had an extra cup of coffee, who knows. But it didn't help that I was significantly overweight at the time as well. Well, he tried to put me on lifelong high blood pressure medication, and I had him put the brakes on. And I said, what if I lose weight and I get more sleep and I learn to relax just a little bit, maybe cut back a cup of coffee? And he said, hey, let's give it a try. And on the next visit, 6 weeks later, I was below normal. My triglycerides were back in line and back on track. I did not need lifelong medication. So my point is that sometimes counseling, encouragement, warnings, and optimism can do wonders rather than a prescription or pills. Now, there are times when pharmacological intervention is absolutely the most appropriate means of treatment, and there are times when it's just not. So find a PCP that knows and understands that. On the other hand, if you're only going to a PCP to get pills and you're not happy if you walk out of a provider's office without a prescription of some sort, well, you would do well to reevaluate your views on healthcare as well. Sometimes it should be on the patient to help themselves. And sometimes pharmacology just can't do the job that is needed to be done. So there's not always a pill for everything, and you need to be going to a PCP that knows that. Also, find a PCP that is on top of research. If you have a progressive PCP that knows that treating pain, according to the American College of Physicians and American Family Physicians, that treating pain is a broad management protocol that can and should include chiropractic, exercise, massage, acupuncture, and lots of other stuff. It includes those things prior to sending a patient to pain management or surgeons, or sending out immediately for MRIs that are pretty much unnecessary and very expensive. Well, then if you found a PCP that understands these things, then you found a good one. Now, as a side note, in addition to having a highly qualified PCP right here at Creekstone Integrated Medical, we also provide all of those services I just mentioned, and more, by the way. So if you don't have a PCP of your own, or you have one that you're simply unhappy with, why don't you call us here at Creekstone Integrated Medical and make your appointment with our medical provider. There is little to no wait. We can usually get you right in and get you taken care of immediately. Medical services offered here at Creekstone include primary care, as we just discussed, hormone replacement, management of chronic conditions, illness care, IV therapy, trigger point injections, platelet-rich plasma injections, or PRP, for hair loss and tendinopathies and joint pain. We offer B12 injections, medical weight loss, COVID, flu AB, and strep testing, and more. Lots of stuff going on here at Creekstone. Lots of good stuff. Now, Creekstone's PCP can help you stay on track and navigate the healthcare waters with ease. So while you're at it, as mentioned, don't forget we also offer a fellowship-trained orthopedic specialist chiropractor, targeted exercise rehabilitation, acupuncture, massage, and more, right here under one roof. Why drive all over town when you can find it all at Creekstone? So get established with a medical home. Be healthier and more active throughout your life. If you're from the Texas Panhandle, or you're going to be traveling through and you need to be seen, call us at 806-355-3000 and let's get you on our schedule. If you're watching us on YouTube or Facebook, please subscribe, like, comment, and share. That is the way of the world these days, and we sure would appreciate your support and your help. Until next week, be safe, and we'll see you then.